Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Important thing is hyaluronic streptococcal antigens and mammalian antigens. See, one important thing is about streptococcus is streptococcal antigens will most of the cases they will mimic the mammalian antigens. So as a result our human body will produce antibodies. Okay, this antibodies is produced against the streptococcal antigen mainly, but unfortunately, because the streptococcal antigens resemble the mammalian antigen, so these antibodies will act on streptococcal antigen, but they also act on mammalian antigen. But that means they are acting on our own cell body antigen. So if they act on our own cell body antigen, that is when the diseases will occur. Autoimmune diseases are more commonly seen. So, what are the antigens and what do they mimic and what are the diseases which result because of this mimicking? This is important. Hyaluronic acid. Hyaluronic acid in streptococcal antigen will mimic the synovial fluid in the mammalian antigen. Synovial fluid also contains hyaluronic acid. So, because synovial fluid contains hyaluronic acid chemically, so hyaluronic acid present in the streptococcal antigen, it mimics synovial fluid of mammalian antigen. So this mimicking will result in the disease called as reactive arthritis. Second, cell wall protein, especially M type of cell wall protein, this will act on or mimic myocardial and myocardium. So when M for myocardium, so cell wall protein M will mimic myocardium, thus resulting in acute rheumatic fever. Then we have cell wall carbohydrate C. Cell wall carbohydrate C will mimic cardiac valves. Because cell wall carbohydrate C mimics cardiac valves, it results in acute rheumatic fever. Cytoplasmic membrane. The cytoplasmic membrane will mimic vascular intima. Because cytoplasmic membrane mimics vascular intima, it will result in acute glomerulonephritis. Peptidoglycan, which is a streptococcal antigen, it will mimic the skin antigens. Because of peptidoglycan mimics skin antigen, so the antibodies which are acting on skin antigens will result in guttate psoriasis, which is seen in children due to streptococcal infection.
thank you and thank you for watching.